Hey, it's Dr. Bill with just the tip of urology school addressing female sexual dysfunction. Fascinating and impressively rewarding topic. You can really make a difference in your practice. What gets confusing for all of us, or for many of us, gender identification issues and a kind of fluid changing sense of self as it comes to sexuality of our patients. Just go with what you know. Remember the basics. Understand your internal and external sexual anatomy. Always understand your basic sense of what hormones do, and consider that you may really never fully understand what your patient is going through. Always encourage a multidisciplinary approach. Look at therapists, psychologists, sex therapists. Look at thinking about novel approaches. Use a multidisciplinary approach. And remember that female sexual dysfunction is really much more common than we were led to believe in medical school and in training. And certainly data indicates that it's much more common an issue than we see with our male patients. And we know that's a big deal as well. Let me impress upon you some basics. You have to let the patient know that they are not alone in this. You have to let them know that this is actually more common than they believe, and it is a fixable event. You have to ask the question. Otherwise, you never get started. So it's incumbent upon us as providers to ask that question. There are a whole bunch of etiologies to concerns of sexual dysfunction in women, very similar to men. And we can look at issues of cardiovascular health and metabolic syndrome, diabetes, thyroid issues, obesity, basically neurologic concerns, vascular issues, hormonal issues, and even psychosocial issues. In addition to all of this, we need to have a comfort level, be fluent in the discussions of perimenopausal and menopausal issues, the impact of neurotransmitters that may have on our libido or sexual desires, hypoactive sexual desire disorders, vulvodynia, clitoral pathology, female genital arousal disorders, or persistent genital arousal disorders. The use and of understanding of what the anatomy does in the pelvis and how sometimes there can be pelvic floor dysfunction, concerns of vaginal prolapse, urinary incontinence. Remember, in about 30% of the time, in men and women, bladder dysfunction can negatively impact sexual dysfunction. So once we have an understanding of that, an understanding of the anatomy and how to proceed with a focused physical exam, then we can have considerations for modulation of neurotransmitters like serotonin and dopamine and norepinephrine, management of hormonal abnormalities, use of trigger point injections for vaginal pain, pelvic floor therapy, use of Botox or neurotransmitters, using genital rehab like we do in men with vacuum tumescence devices. We're not using the vacuum on the penis as in men, but we're using it with that analog, the analogous structure, the clitoris, treatment of vaginal prolapse, and treatment of urinary incontinence. Really a very cool way of making a difference in your urologic practice. The take home, ask the question. That's all you have to do. Simply ask the question and be ready to listen. Dr. Bill with just the tip of urology school addressing female sexual dysfunction.